Hi, everyone. Thank you so much for joining us today. We have a great conversation lined up for you to really talk about some of the observations that we're having in artificial intelligence and healthcare, not only from our observations with customers all across the country and around the world, but also at a recent executive forum that we hosted in Miami last week. Part of that conversation was a space where a lot of our customer executives could share a little bit more about where they're excited about this new technology, where are the challenges, and where they believe what might come next. And I had the pleasure of working with Caitlin Shuman and Dr. Monica Coley on this for this session. And in a moment, we'll have both of them introduce themselves. But by way of introduction, my name is Cabul Mehta. I am the industry principal for healthcare and life sciences at Presidio. In my role, I focus on moving forward with our industry thought leadership, our accelerators, and all different ways in which we understand where executives are facing challenges and partnering with them and our healthcare and life sciences team to identify those solutions that result in the outcomes that they're looking for. So, with me today, I have Caitlin Shuman and Dr. Monica Coley. And what I'm going to do is actually introduce the question that we'll be talking about, which will be about healthcare 2030. But then, as you each answer, I'd love for you to give a little bit of introduction about yourself. So, uh, as I mentioned, we spent some time last week with executives, and we spent quite a bit of time on some mythical scenarios of what the future could be. One of the ideas we talked about was like, what if AI was 99% accurate in diagnostics, and a couple other solutions like that, other ideas like that. But then we also talked a little bit about some challenges that were out there. So, I'd love to be able to talk through Caitlin for you after in your introduction. What do you hope for in artificial intelligence and in healthcare? And what is AI's role in that picture?
Caitlin Shuman here, Director of AI Strategy and Customer Innovation for Presidio. I work across industries helping make sure that our clients realize value in AI. So I talk about it both being really grounded pragmatically in the operational realities and also elevated towards a vision that drives real market value and end user experience. Healthcare is really near and dear to my heart for many, many reasons. I had a blast spending time with Dr. Coley and Kabul last week, as he mentioned at the executive briefing. Kabul, to answer your question, Dr. Coley opened our session with a what does healthcare in 2030 look like? And I thought it was such an excellent grounding to us of what we hope for the industry and from this technology. And when I think about it, I really hope that healthcare in 2030 enabled by AI finally makes good on its promise to be patient, provider, and people centric. That we use the capabilities embedded in this technology to anticipate the end user's problems with better solutions. And that the relationship between the provider and the patient becomes increasingly collaborative and impactful as patients gain more access to and providers gain more insight from healthcare data. So, a quick example of what I mean by that, because it's easy to chat generics around healthcare. Let's think of a patient experience. Let's meet Carl. He's 67. He's diabetic. He has mild heart failure. In 2030, my hope is that his at home monitor picks up 2 days of civil weight gain and a small drop in activity. And instead of right now, where that data sits in a portal that nobody checks until his next appointment in 3 weeks, in 2030, that signal triggers something. An AI agent connected to his monitoring data, his EHR, and his care team schedule flags a pattern as likely early stage fluid retention. And it sends Carl a plain language message asking how he's feeling. Surfaces a brief alert to his care coordinator, opens a telehealth slot in the next 48 hours. Carl admits he's been feeling a little winded. Care coordinator, looking at the same summary, books the same day visit. Physician joins the call, also looking at the same data already pulled and a suggested medication adjustment. She confirms, adjusts his diuretic, sets a Friday check-in. Carl never gets admitted. And his care team caught it on day 2 instead of day 14. And that is where I really see the capabilities of healthcare and AI meeting together, where it's not one fancy AI tool, but it's these existing systems that already are in play in our patient experience and in our provider experience finally talking to each other in a way that's designed for Carl. And that's what I hope we're doing for all of our patients.
No, that's great, and I love that you touched upon experience, which is something that is, particularly, a hallmark of how I like to work with a lot of our clients. Really defining what is that experience, not only for patients, but also providers and caregivers, and trying to when you have that grounding there, to determine what happens behind the scenes that doesn't necessarily get seen by that patient as you described as they're going through their journey. Dr. Coley, love for you to provide an introduction on yourself and your background, and then yeah, help us understand from your perspective what do you hope for with artificial intelligence in healthcare.
Absolutely. Yes, sure. And again, thank you for having me. So, again, I'm Dr. Monica Coley. I'm a health informaticist by training and background. I lead our state and local government, hospital, and health system business at AWS. And also, I'm leading our rural healthcare transformation program at Response with our partners and across AWS industries. So, I'm really glad to be here. I've been at AWS for about 4 years, and I've been in healthcare and health IT for about 30 years. So, I said I must love it or I'm in for the pain, whichever one we want to say. So from my perspective, just tailoring to what Caitlin has already mentioned, in 2030, not only do we see kind of that patient and consumer driven experience that we were talking about, but also it's important that it's expected to be heavily data driven, by which we know AI and ML cannot accurately function without sound data, right? To make these agentic experiences possible and reflective and accurate, right? Healthcare at home is going to be a top scenario. About 60% of healthcare is already projected to be able to be delivered at home. That's helpful not only for rural care, but just healthcare models in general to help reduce the cost of inpatient care. Robotics, digital health, the Internet of Things, those are all going to be key in 2030. So if I had to think about what I'd like to see, and if I put myself in the perspective as a patient, I really like to see how these innovations drive more effective preventative care, care coordination, as Kayla mentioned, and cures. So, I'm at that point in my life that I'm starting to see additional healthcare challenges pop up with the aging process, if you will, for me. And but one of the things I have is keratoconus. It's a condition with my eyes. I had to have a corneal transplant for that. There's no real cure for keratoconus. So how do we use these technologies, right, to innovate, predict this condition, but also to get to a cure? Arthritis. Most of us probably have or will suffer with that, right, at some point. How do we use these predicted technologies, capabilities, and data to really drive to the cure? There was an article I read several years ago that talked about the fact that we used to use the scientific method primarily to set up a research program and establish a hypothesis and then do the research to collect data and come to our conclusion. But now in this world that we live in, being data driven, we have all the data. We have more data than we can think to live with, right? And so how do we already know what has happened. So how do we backtrack from the data we have to find cures, stop disease from the outset, and also to deliver preventative care. So my big bet in 2030 really is that AI will become what I call the new core. So we a lot of times we talk about AI and ML separately as technology, but it's really becoming just an integral part of all solutions in the healthcare and the care that we deliver. So I think it's going to be a huge backbone instead of like being considered like an independent technology, if you will. So that's kind of where I'm leaning, and well, we'll see if it really pans out, but, that's
Yeah.
kinda my thought.
No, it's interesting that you bring up data because that is that came up a couple different times during our conversations last week, and it kind of leads me to my next question about where should organizations and healthcare where should they start thinking strategically. I was at a conference, a healthcare conference in the last 6 to 8 months, and I remember that there were the equivalent of two ballrooms that were dispersed. You had one ballroom that was all talking about what are the latest innovations in AI? How do you move from pilot to productions? That room was at standing room capacity. And just a few doors away was how do you make sure your data is ready to support those AI innovations? Maybe half full in terms of seating. And To me, that was a red flag. I said, th- people don't understand. Like this needs to be, to steal your word, Dr. Coley, a core of what we're trying to do here in order and how it enables. So, I'll go back to you, Dr. Coley. So, where do you see healthcare organizations that are starting to think strategically, and what might get overlooked in as they're starting these innovations?
Yeah, no, that's a great question. I think where I've initially seen healthcare systems really focus their time is really starting in that lens of like ambient listening, ambient documentation, right? Also, how do I use AI to help with appointment scheduling, registration, contact centers? Because so some of those kind of either those frontline capabilities to take the burden off staff or to with ambient listening, ambient documentation to try to take some of the documentation burden off providers, but also to create more accurate reflective notes of that visit, right? In summation. So that's where I'm seeing, AIML initially be explored. Of course, we have, health systems and academic institutions that are starting to look at predictive models and leveraging AI for prediction as well. And so that's what I'm seeing. I think some of the pitfalls or maybe some of the concerns is that how do we implement AI in a way that is not fearful? So, we have a lot of churn in the industry and not just healthcare, all industries about is AI really going to replace a person? Is it going to replace my job? Is it going to replace what we do? And I know in healthcare, we hear a lot about we really need to think about these technologies as being augmentative, not, replacement type. I had the opportunity to guest lecture for some students at one of the institutions here in DC. And that's one of the questions I got asked. So, like, do I need to start looking at other ways or other careers to do my job? Is AI going to take away what I would typically do? I told them it's think of it as an opportunity, just like when the EHR became more prevalent. It changes your job. It changes your focus of your job. It doesn't take away your role. So look how to use these technologies, and healthcare needs to embrace them as well. What's getting overlooked, I don't think business leaders are at the table as much as they need to be. A lot of times we look at these projects as IT projects. These are business projects, these are clinical projects, these are financial projects that impact the business and patient care. So make sure that they're business driven with IT being a supporter of that. Um, Making sure we're also using AI to curb digital deserts, both in, urban areas and rural areas. And then, leveraging it to help curb health disparities. That's something we've never gotten right in this country. And we keep building national blueprints for that, but we need to really, solve it this time. But for all of these things to be possible, the data's got to be right. So this is the opportunity, hopefully, to fill the data room a little bit more heavily, as Kabul mentioned, instead of the AI room or to combine the two topics because you don't have one without the other. But let's get the data right. Let's get it effective so that our AI solutions are more powerful and more accurate and don't end up causing challenges and harm where there was meant to be good.
It's funny. I think Caitlin, you and I were just talking earlier today about how important it is to connect with the not just like the business, the technology business, but also the people, those that lead people, your HR departments, and those that are going to be really important for this. And you're curious if you can expand on that, or just also where you're thinking things are getting overlooked when it comes to rolling out AI.
Yeah, I really loved what Dr. Coley said around the data foundation and then the role of business and IT, really outlining the strategy together. And I think when you run into that conversation, one of the conversations I run into with clients is they go, well, how do I prioritize? Because everyone wants AI, every end user is playing with it and or they're running screaming from it, and both of those, under adoption and over adoption are risks to any organization with AI right now. And I think you have to be really intentional and strategic about how you bring data maturity along the curve and how you bring business and IT together. And this is where, Kabul and I riff all the time on the end user experience. I told that Carl's story really intentionally. What I see often when I'm having conversations about AI implementation and deployment is someone looking at scheduling as a domain or a department as a box for AI implementation, and someone looking at the intake process with a care coordinator as its own potential box for AI augmentation or automation, and someone looking at uh, dosage recommendations as its own separate box for care coordination or AI and AI augmentation. And it's the connection between those two where AI will really drive value for the patient and also for the system, where there's opportunities for cost savings and acceleration for the provider to do the best of their work and the work they like best doing, for us to be proactive in addressing health disparities, as Dr. Coley talked about. And so the challenge that I try to gently offer anytime someone asks me about AI strategy is to say, have you defined that North Star narrative for the end users that matter to you? And in healthcare, it's always patients and clinicians, providers, and it's often also the back office. It's not wrong to start there. And so you really you really need to think about the strategic opportunity in front of you if you start connecting systems instead of just accelerating the automation of existing systems, because then we're just creating a more expensive, disconnected stack. And I think all of us who've worked in healthcare in some capacity or the other know the friction that occurs because of that disconnected stack, the impact to the patient experience, the impact to the provider experience.
There's been a lot of questions to that touch upon what you're saying about where to start, where to actually begin in some of these places. And at the same time, for a lot of projects that I often lead, I've led in my career around the topic of AI. What tends to always come up is the idea of trust. And like, do we start up front? Do we save that to the end? And it's very much the answer is yes, it's pervasive. And everyone in the organization that is about to actually engage in this, they have different levels of trust that are into this, and they're most likely being impacted by their experience in other industries. You know, where you have someone who's just learning how to, have them organize meeting minute notes. Well, okay, that's one experience there. But then, Dr. Cole, you're talking about, well, how does ambient listening come into play? It's not about just about, oh wow, here's this really cool shiny tool that does these things. How do you take into consideration compliance? How do you take into consider accountability? Um, so I'll leave it for either of you. In terms of building organizational trust in AI, what does it take? What are the things that are going to be needed to really make this a success and keep it sustainable and allow for scalability?
Oh gosh, I'll take a stab, I guess, at this one as well. Caitlin,
Great.
help me out here. But I think a part of it is that making sure one, as I was mentioning before, you have the right people at the table to start.
Mhm.
So have your business leaders, have your trusted advisors for the organization, have those influencers, right? Those change management agents that can sit at the table and really help draft the direction. I'm going to be more trustful of something that I had input into, right? And lens into, or that my colleagues or trusted advisors had a part in than I am if not at the table. I think that's what builds distrust is when you're not involved. But then after that, really designing and building AI in a responsible way. So responsible AI, as we'd call it. During that whole life cycle, making sure that you have the right people at the table, making sure that you have the right data, make sure that you're testing and iterating on those models. And as you see challenges along the way, be able to retrain, eliminate bias from models
Mhm.
wherever you can, and then continue that cycle of improvement. You're never done, right? We're never done with that cycle. It's a circle for a reason. You can't get out of it, right? So when you have responsible AI principles are key to making sure you have effective models that are trusted, tested, eliminate the bias where possible in the data, and then also have the right people giving influence into those.
The other thing that just popped into my head the minute you asked that question, Cabo, was focus.
Mhm.
How do you create trust? You create trust with focus and expectations. As I've been researching and trying to dig into what's being successful in governance and trust in the AI space right now, a really interesting framing came up. And I think we feel this anytime we have this conversation is I don't ask my landscaper to submit my taxes. And yet we talk to about AI like we're gonna let it do it all. And so and you have 2 sides of the house, one who hears that and is so excited, and is like, "Let's give AI everything, all my data, all my jobs, all the everything." And then you have the other side of the house that's like, "Oh my gosh, no." Like, don't want a dystopian world in which robots take over the universe. And I think both of those reactions are misplaced focus for AI. So I'm in the risk of genuinely just beating a dead horse. I think this is where purpose-driven AI really starts to make sense, user-centric, having specific workflows you're going after, because you can create governance and trust that accelerates innovation instead of tries to hold it back. The minute you try to throw AI at everything in your organization at once, you're scrambling to wrap your arms around something that you can never get your hands back around again. And there's ways to scale that and tailor that, right? You want to one of the ways that you build governance and trust is by building fluency. So it's actually about how fast can you get kind of table stakes AI in the hands of everyone who's clamoring for it. And then when you're looking at AI that has the capacity to really impact the org, you're probably also looking at AI that has risk associated with it. So then you're targeted and focused about everything we've been talking about, the data layers, the stakeholders involved, the models that you're using, their explainability and accountability and transparency into those, what the job is doing, surfacing that to people. So I think that's the kind of question that I always come at when we talk about trust in the organization is trust to do what?
Mhm.
Are we articulating what it's going to do? And how do we accelerate that fluency and the focus at the same time?
I love what we've talked about of, almost like the fire starters, like what are the things that are going to needed to get things going in an organization. What I've also been fascinated with when it comes to artificial intelligence, not just in healthcare but across other industries, is that it's moving so quickly that I actually believe that the conversation we're having in this webinar arguably could be old news in 3 months in terms of all these other healthcare organizations that are taking this and running with it. So I think the next conversation that's coming is, how do you scale? How do you go from not just a few pilot sites to things are starting to move to how do you actually continue to grow that? From my perspective, actually having pretty strong governance that doesn't limit it, but actually enables it and is able to empower different groups all across a community hospital to be able to recognizing that AI tools are out there. And rather than risk having shadow IT and different LLMs that are just kind of being spattered all over the place, creating some sort of environment where people can go ahead and test and then put things up into production and almost adopting like a product mindset where I think I forget which one of you said it. It's almost like continuous learning, really being able to have that as part of it. So, what do you think is going to be needed as far as fostering the scalability within an organization that people can start to think about right now that they have in place, say 12 months from now?
Yeah, what we're hearing in the industry and what we're seeing with our clients is not their technology isn't the limitation to what we're able to do with AI. It's the data maturity. It's the trust. It's the understanding its limitations. It's the focus. It's the people adoption question that really is going to limit how far and how fast organizations are able to scale AI in a way that actually drives value and doesn't just isn't just innovation for innovation's sake or a solution looking for a problem. And when I think about AI that scales, I think about a couple different thoughts, but I'll stick with 2 right now. One is your end user change management experience is a design principle, not an after effect training event. So, Dr. Coley mentioned this in the beginning earlier on when she was talking about having the right stakeholders in place. So, she was responding to trust. That matters so much when we're implementing AI in the organization. We talked about this in the executive briefing. Is like, how much do you love being told that someone else has a really brilliant idea for your life being changed, right? Like, no one really loves that. If you get to be a part of the design of that thing and you really get to focus the design on the problems that plague you every day and the parts of your job that you hate, all of a sudden you care about the outcome and you're way more likely to use it. So I think when we talk about scale, We have to be talking about who are the change agents in the organization that are necessary to target, because their resistance to this change is going to sink anything we hope to get out of it, and their enthusiasm for this change will accelerate it. And those are the people that we target when we go back to focus, right? For the initial early implementation opportunities for AI. The other thing that I think about with scale is that Carl, to go back to the example for Carl, and how Carl is all of a sudden getting a different kind of care experience when AI is connecting his at home monitoring tool to his care team scheduling and to his care providers. I think the opportunity that we don't realize exists in that connection is the metadata opportunity that exists in orchestrated AI. So, an organization that's doing that with an intelligence layer that can connect those pieces of data isn't just making care better for Carl. They're also making care better for every single other patient who has diabetes and early stage heart failure, because they're going to start catching patterns about when those triggers happen. What other factors is the monitoring tool catching at the same time? What interventions mattered? What titrations worked, et cetera. So for every hospital system, and this is the clinical research in me coming out, you are all of a sudden conducting research with your own patient population. So it's perfectly tailored in a way that you weren't able to before at scale. And I think that's what's really going to differentiate organizations that are accelerating value out of AI and changing the healthcare experience in the next couple of years versus ones who are just tacking on AI to different existing departments and domains. Is really, do they build that intelligence layer to capture that data?
No, I hear that. What about you, Dr. Coley? What are you thinking in this space?
So when I think about scale, I see it both within an organization and externally. So I think within an organization, totally agree with Caitlin about those change agents having a seat at the table to really get that to, diffuse through the organization. I think also making it part of your strategic plan. So if you've ever noticed a difference in a conversation and a strategy that you aligned, to a strategic plan. So if you have AI built in to your 5-year roadmap, your 10-year roadmap, your plan for the health system, I think that will help things go a long way because you got vested interest from leadership and stakeholders in that. When I think about scaling externally, we've got to learn to share. Um, I don't need to redevelop a solution that another health system's already developed or an academic institution. So really beginning to share best practices, models kind of in an open form, just like
You're so good at
we've
that,
gone
Dr.
open in so
Coley.
many other areas. So let's get open here, right? And take away that fear of I'm gonna share a model and the competitive lens to that and how could we all improve patient care together, whether that's through collaboratives or other means. So I think that that's what's gonna take it really to scale. I was in implementation for several years in health systems and EHRs. One of the top questions I got asked is, what are other customers doing? You know, I don't need to reinvent this. What's your best practice and what are other customers doing? Let me see what they're doing. Let me talk to them. Maybe I can model that with a few tweaks. So I think that's what we need here to scale as well, to be honest, in the market and from other trusted sources.
No, I think that's great. And it makes me think about like, where are we headed in some of the recent conversations, not just about scaling, but also what's coming out in the market from these other enterprise organizations that have put new agents out here. We'll wrap up our conversation with this question. I'll go to Dr. Coley first, and then I'll go to Caitlin. Dr. Coley, when you and I were at HIMSS just last month, uh,
Mhm.
the big thing that was coming out on the big floor and the announcements was every large scale enterprise seller that had this or this agent or that agent, and they had all these different solutions. Go ahead and you could implement it and it will solve everything. And there were a lot of conversations that I had in the hallways outside of the ballrooms or, at a dinner or at a lunch where a lot of healthcare executives would confide to me saying, I don't know if we're ready to go after this just yet because you can have this agent and this agent over here, but how are they going to conduct or rather orchestrate all of it together? And then once you have that, how are you actually going to observe or even audit what actually gets done here? How do I start to build a strategy around that? So, I'll start with you, Dr. Cole, and then Caitlin. When we're talking about orchestrated AI in healthcare, I'll ask two questions. And one is, what are you most excited about? And the other is, what makes you most nervous about this space? Because this to me is the big question that's going to be coming up over the next 3 to 6 months as we continue to evolve in healthcare.
Awesome. So, what am I most excited about? So, I'm going to use myself again as putting myself in the lens of the patient. So, I had a recent hospital stay in February. And as a part of that, I'd said one day I'm going to tell the story and call it 4274, which is my birthday. I got asked that question probably 50, 60 times, probably in a 2-day period. And as a part of that, I noticed that not only within the health system, but that when I returned home and started to have follow-up visits, even if I had my chart, even if I had information, I had repeat tests.
Mm. Mhm.
So, like, I have repeat labs, repeat questions,
100%.
repeat questions about meds, all things that I've already shared somewhere else, right?
Right.
So, when you think about that, I'm sitting there trying to coordinate my own care, summarize my own care, and give and bringing everybody information that I felt like and sometimes I've already given you or you should be able to pull. So, I'm excited about, you know, orchestration being able to play a layer. So, one example I heard about kind of like a team-based intelligence approach about I have one agent that's gonna summarize my chart, another one that's gonna flag any risks about me, another one that's gonna, recommend evidence-based interventions, and another one that's gonna handle documentation. And they're all gonna work together as like a clinical decision support team. These agents being orchestrated, um, have the same data, maybe play a different role, but have the data in a manner that, you know, I don't wanna tell you 4274 50 times a day, plus all of this other information that you should already have. So how can AI help us to manage that care coordinated process and information sharing more effectively across the care team is what I feel excited about. I think that, you know, anyone would be concerned about making sure that the recommendations that are coming out of AI are actually effectively evidence based. That's the goal, but making sure there are, but understanding how those decisions got made. So we're all concerned about the black box, not knowing how it got to this decision. We've all seen the 60-minute stories where we're like, we didn't even train it to do that. So making sure that as we leverage these tools, we're better about understanding how it's trained. We're better at understanding making sure that the evidence is really sound, that it's putting forward and trusted, right? And so that it can be something that's adapted, right? We're already seeing some articles about that some people trust AI more than they trust a human, right? Provider. But if you're gonna trust that, it better be legit, evidence-based and legit, right? So I think that would be my concern, or making sure that we get that right as we start to diffuse these technologies into clinical care.
Yeah, no, it was really remarkable to hear the latest data about how much people are putting the primary question that people are asking ChatGPT, Claude, other is way over 50% as far as the healthcare questions go. So it's yeah, that's the world we live in, and well, at least we have the data on that now. We kind of know where we can support people. Keelan, what about you? What are you most excited about with an orchestrated AI in healthcare, and what gets you most nervous?
Yeah, I think what Dr. Coley was talking about, what you're talking about with patient, there's a real genuine thing that we have to look at for healthcare systems at the disparity between patient trust in AI and provider and clinical system trust in AI. And we talked about this at the executive briefing. There is in the democratization of information, not necessarily wisdom or insight, but information through AI into the hands of patients increases patient choice in their care. So while there's this incredibly exciting opportunity that I see for, we talked about the hospital without walls, right? Where you become genuinely operational and having the right at home monitoring, the right connection, the right systems and infrastructure to understand what's going on with patients and to provide care where they need it, when they need it, was really exciting to me. I think what also keeps me up at night is the real concern that from a healthcare perspective, we will under acknowledge and undervalue patient choice and care, hedge our bets with AI, and lose our patient base to what gets them the whatever they want, whatever they and their AI tool have decided is right for them, the right thing faster. And there is at the end of the day, when patients are really sick and they really need help, they will always go to their doctor. And that's who you want. We want to get them sooner to improve their outcomes better and faster, which means we need to be creating those frictionless orchestrated experiences for our patients. And that really feeds, underneath that, two hopes for me. Concerns disguised as hopes. And one is that we will think about the orchestrated experience early, that we won't accumulate tech debt because we've deployed agents and deployed different software tools in different places so fast that we can't unravel it and make it make sense together, or we've just created the biggest data modernization headache we could possibly create, right? In trying to connect these different tools and systems. As Dr. Coley said, like sharing models, but also sharing data. Like we're going to have to build better systems for doing this in ways that are regulated, compliant, and approved. The other piece that I think is the big opportunity here, right, is equity. And we spent some time talking about rural health, and Dr. Coley is working on really cool parts of that initiative. And I think there's both a risk because the systems that have the most resources to do this are the ones that aren't necessarily the safety net hospitals and the rural hospitals. And they're also those are the systems that need it the most, who could really accelerate their commitment and their impact on patient outcomes and lives through coordinated, orchestrated, extended by AI care. And that's what I really hope that we're able to drive into this moment, is to say, where are the ways that we can, like Dr. Coley said, drive equity for our patients through the
What
way
I,
that we.
what I love about what you and Dr. Coley has shared as we wrap up here today is that we've effectively bookended this conversation around the experience. What is the experience that we're trying to create? And I feel as though in all of our respective conversations with the customers we're partnering with, if we can continue to lean into that of, well, why are we doing what we're doing? We're doing it for that patient. We're doing it for that physician. We're trying to do it for the clinician and really trying to think about what's going to be most important and most effective so that they can actually move forward and provide better care and above and beyond what they are typically giving today, better the status quo. And I love that this will continue to be part of the conversations and a lot of what we're driving with a lot of our customers. So, with that, I just want to say thank you once again for taking the time joining us for this conversation. I'm looking forward to having more conversations like this with you all and with many of our customers as we continue to navigate this journey. Thank you very much, and I look forward to talking to you all again soon. And thank you all for joining us today.